On DSM criteria. Good morning. I'd like to thank Çiçek. Well, there was a case of mine 1 month ago, and I think my awareness about hoarding disorder is just raised today. And in those days when I received that case, I also investigated. And if I did not know about this hoarding disease, I would have diagnosed the patient with OCD. Therefore, I believe that I'm going to benefit from your experiences as well. So thank you very much for the presentation. I'm going to talk about another disorder in the generalized anxiety disorder. It's not going to be a new diagnosis, but I'm going to have a critical view to an already existing diagnosis. So in disfiguring social disorders, social anxiety disorders, I'm going to talk about the DSM criteria. Well, I'm going to talk about 5 basic elements: the epidemiology of social phobia, and then I'm going to talk about the treatment-seeking behavior of the patients, and then I'm going to talk about the social phobia criteria of DSM-4, then analogy, and then I'm going to provide you with some evidences from our country and abroad. Well, when you look at the epidemiology, in fact, there is a prevalence, a certain prevalence of this disease. The social anxiety disorder is an important disorder among the other anxiety disorders. The lifelong prevalence is higher, actually, and many patients do not come to us because of the nature of the disease itself, because they are already avoiding social contact. And most of the time, the disease starts at the age of 25, and it is the 4th most frequently seen anxiety disorder. Almost half of the patients do not seek treatment, and particularly there are some additional psychopathologies in half of the patients. And most of the time, the social phobia patient is actually seeking treatment for other psychiatric disorders. Sometimes we are talking about 15 or 20 years of delay in the treatment-seeking behavior, and 3 to 7% of the first-line treatment patients are having this disorder. There are some associated situations. I'm going to skip that because most of the time there is loss of competence, and we know that already. About treatment seeking, I would like to share with you an article. Well, in outpatient clinic patients, the most important predictors of treatment seeking is that not the social phobia itself, but the depressive disorders are problematic, and these are firstly diagnosed by the clinician, and then secondly, the number of the social situations that is feared by the patient is high. So if that is the case, these are the predictors, particularly if we have the BTA, depressive disorders, then it is an important predictor. Therefore, if we are aware of this, just like in the hoarding disorder, if we have in our minds that this could be social phobia, then if we can be attentive, then there can be more diagnosis of the patients, and we can also provide some treatments that would benefit the patient. On the one hand, we have the patient and characteristics of the patient. On the other hand, we have the diagnostic criteria in DSM-4. I'm not going to read it through, you already know that, but I'm going to talk about one single criterion, which is called the criterion H. So, even if there is a general medical condition or another mental disorder, even if there is a general medical condition, the fear which is mentioned in diagnostic criterion A is not related to this. during the transition from DSM-4 to DSM-5, this criterion was discussed a lot. I'm going to talk about those discussions. For instance, stuttering, Parkinson's disease, anorexia, bulimia, or other disfiguring medical conditions just came to my mind, and I'm sure that you have many more examples. So then we were not able to diagnose these patients with social phobia according to the DSM-4. This was subject to a lot of criticism. What happens to those who have physical diseases, physical disorders? So this is a very important area for loss of competence, and it is possible to treat these patients because we get good response to treatment, but this criterion was actually preventing the diagnosis. And if there is a comorbid situation, then it was very difficult to diagnose. Already we are talking about a combination where we have the difficulty in treatment seeking. Let's make an analogy. Think about a medical condition like stuttering or tremor in Parkinson's disease. Okay, the patient has Parkinson and tremor, and the patient may have some social phobia. I mean, this is what is lying behind the criterion. So think about depression. Okay, the person lost his spouse or his wife, then of course he's going to be depressed. This is just like that. Or think about a CA or cancer. It has great pathology, but also it brings depressive indications. Then the idea is that this is very normal, but are we not going to diagnose these patients with depression? If they have depression, we should diagnose that. So if there is a medical condition accompanied by a social phobia, then we should be aware of that fact as clinicians. There is another analogy, maybe this is a stronger one. It is the PTSD. In PTSD, how can we diagnose PTSD without having trauma? Is it possible? No. So there should be a reason, absolutely. Therefore, regarding this criterion, there are many studies conducted in the last years. Particularly, just after DSM-4 was put into practice, Oberlander and his colleagues published a series of cases. I'm going to skip them. And in the cases that they reported, they talk about patients in which we have the medical condition, and they checked whether these people would be diagnosed with social phobia, and if they are treated with social phobia, are they getting benefit or not? And then they actually question the validity of this criteria, because the patients get the benefit from the treatment. Then there is an article of Yasin, which was published in the American Journal of Psychiatry in 1996. This was done on stuttering. You know that stuttering may cause anxiety, and it can be seen together with social phobia. We know that. In this study, Stein and his colleagues just suspended the implementation of the criterion age. When they did so, the presence of social phobia was overinflated. And also, they suggest a criterion that is a remarkably high anxiety level. If they identify that, then the social phobia is present in 44% of the cases, according to the modified criteria of DSM-4. These are some numerical results of this study. I'm going to skip that. There's another patient population, psoriasis. This can be quite critical. I'm sure that you have experienced this in your clinical practice. Social phobia indications or symptoms can be seen in psoriasis cases. These cases can be very problematic, and this study was carried out by Turkish colleagues, published in the Turkish Psychiatry Journal, and they investigated 32 patients, and psoriasis disease patients had higher levels of social anxiety and phobia compared to the normal control group. In 2000, 2001, Halise and her colleagues carried out a study, and this was published in Journal of Neurology and Neurosurgical Psychiatry. They conducted this study on spasmodic torticollis, and 116 consecutive spasmodic torticollis patients are taken at hand, and I would like to share the results with you. In this study, there are many findings. However, in general, I can say that social phobia was detected, was identified with the flexibility on the DSM-4 age criterion. I mean, we could not recognize social phobia if we did implement the strict criterion age, and it was around 41% when the criterion is relaxed. And also, there are some, according to this study, this criterion is criticized, and real social phobia is neglected according to this study. Then we know essential tremor cases are quite frequent in our practices. By the way, I have a sibling who has essential tremor. I'm quite interested in this. So they also have 32% of social phobia prevalence when the diagnostic criteria are used in a more flexible manner. So from 2001 until 2006, there is no other study, but in 2006, upon the recommendation, the suggestion of Volkan Topçuoğlu from our clinic, we planned a study, and we studied essential tremor. And the criterion age about social phobia is suspended, just like in the other studies. And in that case, we found out that the 42% of the patients could be diagnosed by social phobia. And we understand that 60% of them do not get the diagnosis of social phobia. We should also understand that the 40% is quite high. Maybe it is overinflated. However, this is a population that should be recognized. And here, these are figures, but I'm going to skip them because of time limitations. So, social phobia is diagnosed in the essential tremor cases, and sometimes it is not diagnosed. And what are the diagnostic criteria for loss of competence? And what about the disability? And how can we score it? I mean, the quality of life of the patient is evaluated not only on the basis of tremor, but also social anxiety symptoms. I mean, the social anxiety symptoms are also disabling that person and reducing the quality of life. So this was the comment interpretation that we had in this article. We also focused on the cross-eyed patients. This also yielded similar results, and we see that it is about 50%. I mean, no matter which disease we are dealing with, we found something. I mean, of course, in terms of methods, we cannot suggest a very well-established result, but the journals actually accepted our cases. So, but there is a fact that even if there is a medical condition, then people may go through social anxiety. We cannot say that this is stemming from this particular condition. I mean, because this is a disabling situation. I do not want to get into details, but we can say that there are findings where we have the validity, structural validity of suspending the criterion age. And again, we also looked for the predictors of disability of the patients. So strabismus patients are taken at hand in this study. And is this just the severity of the strabismus patients, or so is it social anxiety that is making them worse? This was the question. And when the criterion age is suspended, if DSM-4 was used in modified manner, then we can say that disability in the social life is an important diagnostic criteria. What about the acne patients? Of course, this age group of acne patients is an important age group, and this was published in 2011, but the study was done a couple of years before. So this time we included a higher number of patients. In total, we had 204 cases and control group, and again it is as high as 40%. Let me talk about predictors. I mean, when we say social phobia, are they disabled more, and is it related to their social anxiety, or is it a separate load? Then again we can say that social phobia diagnosis is a problem for disability. Could you please sum up? Of course. And lastly, there's a study conducted on obesity, and this was done a couple of years before DSM-5. And also, we know that this is an important patient group. They come to us for evaluation, and they have social problems as well. In addition to that, they wanted to see whether we can have the same diagnosis or the same evaluation by changing the criterion. I mean, in terms of disability, in terms of prevalence or difficulties in life, are they passing through the same things if they have the diagnosis of social phobia or not? And the past history of the patients are taken into account. Social anxiety disorder may be present independent from obesity, and this is completely loyal to DSM-4, and approximately 135 people are as such. And if they modify the criterion age, and if they suspend criterion age, then there is a social anxiety diagnosed population. It is 40 in number. It's a little bit less. And then they take a very large control group with no disorders. So they checked whether the disabilities of these two groups were similar. Well, from many aspects, in terms of social functionality, even in the adolescent period, and also with their current social functioning, global functioning, and social impairment, according to this scale, they saw that those two groups were similar. Well, the problems are similar. On the one hand, we diagnose them as social phobia, and also on the other hand, when we suspend the criterion, we still have these problems. But if we do not suspend the criterion, they would not get the treatment. In conclusion, I'm going to sum up in a couple of slides. If there is a disfiguring physical problem of the patients, then they have more social anxiety when compared to healthy individuals. If the modified criteria are used, then an important amount of these patients are getting the diagnosis of social phobia, and these social phobia diagnosed patients have similar characteristics if that diagnosis can be done by suspending the criterion. There can be different clinical features between those who have the social phobia diagnosis or who don't. However, the social phobia is clearly seen in these patients, and being independent from the medical condition, the additional disability is actually distorting the daily lives of the patients. Well, about this social anxiety and social phobia, there is a working group of the DSM, this working group had a consensus on the fact that some patients and or diseases like social phobia may be neglected when this criterion is implemented, and they had some recommendations, and this recommendation is accepted in DSM-5. So in the end, in the definition of social phobia, they are talking about a social phobia which is not dependent on the medical condition. That is, previously we had a very strict relationship where we had that if there is a general condition or other mental disorder, it is unrelated or not associated. But in DSM-5, in extreme anxiety or excessive anxiety, then the decision is left to the clinician. And they can be more subjective now. And the clinician should collect as much information as possible. I mean, we should not only base our decisions on the self-expressions of the patients. So now, if there is a medical condition, then fear, anxiety, and avoidance is not related to that, or it is not proportional. Is it going to be a solution? We don't know. Well, I just scanned PubMed yesterday. I don't know if you can see it. Here, let me say, I just typed DSM-5, social anxiety, and stuttering for the keywords for my search. When I did that, I found 2 articles. So this is the case by the late hours of yesterday night. I don't know whether there is a new study in the meantime. We have the studies from 2011. So there is no new article, and we don't know whether DSM-5 solved the situation or not. And also I have typed DSM-5 social anxiety and tremor. There are 3 articles, one from Turkey, and you can say that in 2008, 2001, these are quite old articles. So we can work on tremor. For obesity patients, I found 6 articles. One was already in my presentation. The other ones are quite old articles, and we don't know, therefore, whether the modified DSM-5 criteria would meet our need. Another topic that we investigated was acne, but you can see that there was no article. The other one was strabismus, and there is no article on that. Therefore, we don't know yet whether the new criteria changed our perception, and so this is an area where we can have a lot of investigations, analysis, etc. And psoriasis was also investigated in Ankara, as you remember. So this is an open field for study, actually. So in summary, I would like to say that social anxiety causes an important disability. And in other medical conditions and in other psychiatric disorders, there is not this strong reference to the underlying medical conditions. And because of that fact, people do not seek help, and they are just turning their back to the society, and they just do not come to us very easily, and these criteria and this approach is making it even more difficult. Thank you.